randomized trials in journals you've heard of, JAMA, Lancet, New England Journal, in thousands of significantly ill patients that TPN has no association with infection risk in 2022. Many good studies in good journals. And these basically show that it's just as safe to put TPN through a central line as it is saline through a central line. They're equally safe. And so why is this? Well, there's a lot of reasons. One is we don't hyperalimentate anymore. We actually now are measuring our patients' needs with things like indirect calometry and other measures. We control hyperglycemia. Virtually all the trials that showed a risk of infection with TPN were when we let glucoses range up above what we would ever do now. When I was a resident, we didn't treat hyperglycemia until the number was above 350 in US units. And so now we would never do that. And so all these old TPN studies didn't control for hyperglycemia. That just started in 2001. And now we give more protein, we have better central line care with our checklists, and we have better lipids. And so we'll talk about that in a moment. So even our guidelines have now caught up. Our 2022 Aspen ICU nutrition guidelines say there's no difference in clinical outcomes between early EN or early PN, and they can be used interchangeably. And so I think this is essential, that we recommend either PN early or EN early is acceptable when we need to deliver nutrition. And again, the clinical outcomes are the same, and this is a strong recommendation. So this is a major shift in the Aspen guidelines.